Hi, this is Emily. I'm at my post-op appointment right now, and I just yesterday had my calves and my arms done for my lipedema procedure. I just wanted to share my experience with anesthesia and without anesthesia, because the first surgery when I had my thighs done, I did have the anesthesia, and the second surgery yesterday, I didn't have the anesthesia. So the first surgery, definitely during the surgery there was no pain at all, but afterwards I was really nauseous all day and I wasn't able to drink that much water at all, which is super important to help with swelling. It was really hard for me to get any water down. I was sleeping all day because I was really just tired from the anesthesia. I was just exhausted all day, could barely do anything. And I wanted to try it without the anesthesia. Before the second surgery, I used something called Pro-nox, which I had control over the whole time. They do give you a Valium first, just to calm you down, get rid of the anxiety, which definitely helped a lot. And then the Pro-nox during the surgery, it's just a little tube. It's like if you're at the dentist, it's the laughing gas. You're just able to suck it whenever you want to, and which it was nice to have control over, because when I did start to feel a little bit of pain, I would just breathe in some more, and it helped so much. It made the time go by super fast. It did not feel like 3 hours, which the surgery was. They were very similar, the two surgeries. The only difference, I did feel a little discomfort during the surgery. It wasn't bad at all. I wasn't like in tears or anything. It was just, you know, little parts where he would get, I would just feel it a bit, but it wasn't too bad at all. Definitely worth it though. If I would have known how I felt this second surgery, I would not have done the anesthesia the first time, but I'm happy I did try out both, so I can now compare, and now I know what both is like. But I'm definitely feeling super good today. I'm able to walk, and yeah, I'm feeling great. I was nervous that it was going to hurt a lot more, but it's not hurting at all. So.
Well, good. You're doing really well.
Getting some beautiful fat out. Okay, let's bring this leg back a little bit. Good. Just bend this leg just a little bit. That's perfect. Great. And let's put the foot up like that.
So how's that gas doing?
It's good, yeah.
Yeah, it helps to kind of just...
Oh, totally. Yeah, it definitely, like, I can't feel anything right now. I feel totally calm, so.
Oh, good. I'm glad. You're doing really well, though.
It's great.
So do you know what you want to do when you get older?
I'm thinking I want to be a dietitian.
Oh, really?
Yeah.
Well, that's what your dad said that. That's cool.
Yeah, definitely. I mean, ever since I started eating healthier and paying attention, it's just super interesting to me.
Back, straight both legs again, that same thing. Lock them tight, hon. Good. Can you start to understand the benefits of having you awake, being able to assume this positioning?
Oh yeah, totally.
Yeah, I mean, especially areas of the calves and ankles, which you're dealing with a very thin layer that curves very quickly. It definitely helps to have the patient not completely unconscious.
Totally.
So how much pain were you having with your lipedema?
It would just come on every once in a while. It wasn't like a constant pain, but some mornings I would wake up and the whole day my legs would just be super sensitive.
Yeah.
It happened a lot too when I would stand for a long amount of time. Like if I was standing still for over 10 minutes, my legs would just start to get kind of like restless and I would have to sit down.
Right.
But since I started working out so much, I think that helps, just the movement. It definitely slowed down the pain, I think, but it definitely still, some days I would wake up and it would hurt a bit.
Bring this back like that and turn the foot up like that. That's great. Good positioning. Give me some beautiful, beautiful ankles.
So if you think you have any of the symptoms close to lipedema, if you're thinking you have lipedema at all, definitely do as much research as possible. Although there's not a lot of information, there is some that definitely helped me for sure when I was figuring out if I had it and if I didn't. Definitely go to your doctors if they don't know about it, make them aware. That's what I did. My primary care doctor didn't know about lipedema, and now she does because I, made her aware of it. So definitely I would recommend to do the same thing because the more people that know, the better. And definitely if there's anyone in your area, obviously I recommend Dr. Amron. He was amazing. But just try your hardest to find information because there is some out there.